Hi everyone. Thank you very much for being here again with us on a Monday night. Tonight we have Katelynn, who is a first-year PhD student in political science, and she's going to give a presentation on what we learned, and I guess what we didn't learn, in the COVID-19 crisis pandemic. Just a note before we start, Katelynn has brought some masks, some KN95 masks, who are here on the left for attendants to wear. I think that's it. The floor is yours. And by the way, please feel free. Please come grab one.
Oh yeah, if you want to take a few minutes to grab a mask now,
Yeah.
totally fine. 60 seconds, go. Great. So can everyone hear me all right before I get started? Folks in the back? Awesome. Never know how to gauge my voice in these types of rooms. So as Pedro said earlier, my name is Katelynn Kowalchuk. I'm currently in my first year of the PhD program in political science at UNBC here. I'm currently going to be presenting on my research with a lab I'm a part of at McMaster University, which is called the Lessons in Crisis research team. And before I begin, I would also like to take a moment to acknowledge that Green College and this talk is taking place on the traditional, unceded, and ancestral lands of the Musqueam people. So before I begin, I'm going to get into a quick overview of how the talk is going to proceed, because there's a couple different moving parts. So first, we're going to start with a brief introduction to the context and the material that I'll be talking about today, as well as providing some background and contextual information that'll help to, answer some questions you might have about this type of topic or what I'm going to be talking about. I'm going to briefly talk about our decision of case studies as well as our data before we get into some preliminary findings. Now, this research lab has been going on for the last year and a half, I believe. I joined it in spring of last year, and I'll be presenting on some early descriptive findings from one of these ongoing projects, which hopefully will culminate in a paper that the research team will be presenting at a conference sometime in May. And following that, I'll briefly discuss some of these early findings and some of their potential implications, and we'll conclude with a Q&A session at the end that should last 30 to 40 minutes, depending. So the Lessons in Crisis research team at McMaster University is concerned with a couple different questions about how Canadian governments understand risk, specifically in times of crisis such as the COVID-19 pandemic, make policy decisions in times of crisis, as well as how they communicate these decisions to the public, as well as how they learn, or if they learn, from past experiences. And our current project compares school closure policy in Alberta and Ontario during waves 1 and 3 of the COVID-19 pandemic. And we asked the principal question of what can account for variation in the timing and length of school closures, which, shockingly enough, they do actually vary quite a bit between the two provinces in terms of both timing and longevity. So both provinces made the decision to close public schools during both waves of the pandemic, though for different lengths of time and at different points during the waves. And some earlier research has accounted for the epidemiological conditions during these periods and found that decisions to close schools weren't necessarily linked to the COVID conditions at the time. And they didn't seem to have any impact on the timing of the closure or reopening, as well as how long these closures lasted. So if these decisions to close schools weren't driven by epidemiological conditions in the provinces, what can they be accounted for by? And that's what we aim to answer causally within the paper. So a brief note on the case studies. So we chose Alberta and Ontario as our two case studies for this project. One of the main arguments that someone might make when you say, oh, well, it wasn't COVID conditions that resulted in these types of policy decisions, maybe it was partisanship or ideology. And part of the reason we chose these two cases specifically was due to their similarities in these regards. Both had majority conservative governments during the periods of analysis. They also shared similar ideological and policy priorities as well throughout the pandemic. And the data itself comes from a collection of public government briefings as well as press releases that I believe are all publicly available. I don't think we had to FOI anything, which is great. Between March to June of 2020, which is wave 1 of the pandemic, and April to June of 2021, which accounts for wave 3. And we're going to be conducting a textual analysis of these briefings in both provinces using NVivo qualitative data analysis software. So there are two main problems or areas of inquiry that this paper is going to address. And the first, and probably the most prominent, is the question of causality. If epidemiological conditions didn't seem to play any role in determining the decision to close schools or their length of closure, then what can account for that variation in these two cases? However, I'm concerned primarily today with the descriptive questions that are raised within our paper, specifically things like how evidence is used by governments to justify school closures to the public, or how the risk of in-person schooling is discussed by political actors. And political actors in our case means a few different types of people. The first is the premier of each province, the chief medical health officer of each province as well as the ministers of education, I believe, in both provinces were the three main actors that we're looking at in these briefings, though some other folks do make an appearance from time to time. And in my discussion of the descriptive aspects of this project, there's three themes that can be kind of needed out of them. And the first one of these is chronological representations of discourse, so how these things have evolved over time. Risk and reassurance in school settings. This is kind of getting at like the meat and potatoes of what the project aims to look at. And the third one being the idea of personal responsibility and this vague notion of doing the right thing, which comes into place surprisingly often in these policy briefings. So the first of these is the chronological representation of how different areas of code have evolved over time. And we can look at things like evidence sources between waves 1 and 3, who is being cited as an evidence source during these different junctures within the pandemic. And we can also compare how these variables evolve both within provinces over time, but also looking at, what are some differences or similarities between these two provinces and how they communicate this risk or how they use evidence within these briefings. So the rest of the charts will look something similar to this, which I'll briefly explain here. On the y-axis, we currently have use of evidence coding. These include a variety of different experts or sources that a government may cite within these press briefings or government documents to support whatever statement they are making at the time. On the x-axis, we have our two provincial cases of Alberta and Ontario, Alberta on the left in blue and Ontario on the right in green. And the charts here indicate the number of references that is made to each type of use of evidence within each area of inquiry. So for example, if we look at row 4, other jurisdictions, under column 1, which is Alberta documents in wave 1, we can see that there were 59 references in these documents to other jurisdictions as a source of evidence. And other jurisdictions is purposefully vague. It's meant to encapsulate any other jurisdiction other than the government of Alberta itself. So this could be something like a reference to Saskatchewan, it could be a reference to the federal government of Canada, or it could be a reference to an international jurisdiction or country as well. So initially we see how the use of evidence evolves over time within both provinces. And if we look at Alberta in wave 1, we can see that they rely most heavily on other jurisdictions. This carries on into wave 2 with being the highest representative group out of any of those types of evidence overall. They also make substantial reference to unspecified sources as well as unspecified other jurisdictions. So unspecified sources of evidence would be anything like the evidence indicates that masking is an effective tool to prevent the spread of COVID-19. So they're talking about evidence, but they're not actually saying what the evidence is or where it's coming from. And it's a similar case with unspecified other jurisdictions, where they might say something like, other jurisdictions around the world have found that schools are safe, without actually saying what these other jurisdictions are or what sources they're citing themselves. So main takeaway from this one would be that Alberta is relying predominantly on other jurisdictions, as well as unspecified sources of evidence within these press releases and public briefings. Ontario, we see more sparse references to other types of evidence, but with a very heavy focus on internal local experts. And this isn't necessarily surprising when we consider that Ontario was one of the provinces that had a dedicated COVID-19 science table. A lot of the time, they relied very heavily on their own in-house research. So this isn't necessarily surprising in the Ontario case. The following is a look at pandemic severity risk and how discussions around that have evolved over time in both provinces. We can see in both cases that there is quite a bit of dedication paid to talking about COVID cases specifically in Row 1, specifically so in Alberta, though there is also quite a few mentions of health system capacity as well, which is referring to stuff like, do we have enough beds in hospitals? Do we have enough human resources in hospitals, etc.? One thing that we don't necessarily see a ton of, but it does improve between waves 1 and 3, are references to school operational capacity, as well as school outbreaks. And this isn't necessarily surprising either, given that, the school closures came a little bit later, a bit more policy, mumbo jumbo in that process. Ontario, we see a bit more diversity, I suppose, in the types of pandemic severity that is discussed. But again, with COVID cases being one of the most dominant ways to look at pandemic severity, again, not necessarily surprising, though it is interesting to see how little attention is paid relatively to some of these other variables, such as health system capacity. And the last thing we'll look at in a strictly chronological sense are instructions for individual action on the y-axis. So these are a variety of different mitigating factors that one could take to prevent the spread of COVID-19 that a government may recommend to people within a press brief. So in Alberta, in Wave 1, we see, again, fairly broad instructions for personal action. There's at least somewhere around 19 or 20 at minimum for most of these, with the exception of vaccinations or watching for misinformation. Again, not necessarily surprising given that vaccinations were not a thing during this time for COVID-19. However, what I do find to be quite, maybe not surprising, but really interesting, is how all of these references drop substantially by Wave 3. So we can see that even something like reducing exposures in Row 3 drops from 27 references in Wave 1 to 14 by Wave 3. And we see a similar pattern with nearly all of these, with the exception of vaccinations, which appears to become Alberta's extremely dominant instruction for individual action, though they do still make some references to other forms of action throughout. Ontario, we see something a little bit similar, though to a much lesser degree. We see a focus in Wave 1 on reducing exposures, self-monitoring for symptoms, and social distancing as their key reinforcement mechanisms for individual action. And by Wave 3, we see that all of these drop quite substantially, with, again, a focus on vaccinations coming in at 9 references. So a smaller, it's not as strong as what we see in Alberta, though I do think that shift is still quite interesting. So this is where we're going to start to talk about risk and reassurance, specifically in a school context. And this is really getting at the heart of this project. We're really curious about the conditions of schools and what drives these policy decisions around schools. It's fundamentally an education policy project in the context of, times of crisis, aka COVID. And the following slides look specifically at how risk and reassurance is discussed in relation to schools, both Ontario and Alberta, over time. And the final slides in this section also look at how reassurance interacts with evidence and what evidence is being put forward to support reassurance in a variety of different capacities. So what is reassurance? On the y-axis, there are 6 different measures of reassurance, which are divided into 3 separate categories. The first 2 are appropriate measures are in place, and the second being evidence-based decision-making. So these first 2 I call the decision-based reassurance, The third and fourth rows are about children, children-based reassurance, and the fifth and sixth are specifically about schools, so school-based reassurance. And if we look at Alberta in Wave 1, we see that there's, again, fairly diverse references to all of these different types of reassurance throughout that 3-month period. Though with a slight primacy given on things like schools are safe and evidence-based decision-making, but not by a lot. However, by Wave 3, we see that this drops to nearly nothing in terms of decision-based and children-based reassurance. It shifts almost entirely to schools being safe and schools being not being sites of transmission. In Ontario, we see something different, a primary focus on appropriate measures being in place, with a few references as well to school being safe. By Wave 3, we see, again, it diffuses out to be a few references to decision-based reassurance, as well as a few references to schools being safe, but no mention of reassurance for children at all throughout, which, especially given how it basically fell off a cliff in Alberta by Wave 3, I think that that's an interesting finding that I'm really excited to delve into a little bit deeper as the project evolves. So this got me thinking about the use of evidence in regards to reassurance. It's really difficult to think about the concept of, maybe interpersonally, we can reassure our friends, our family, but governments offering reassurance without any evidence to support that reassurance is a little bit dubious at best, in my opinion. So we can see here a cross-tabulation of evidence type and reassurance. Reassurance being on the y-axis and evidence being on the x. And this is Alberta Wave 1 and 3 combined, and we can see that two things emerge. The first being that Alberta, again, primarily references other jurisdictions or unspecified sources of evidence when talking about reassurance, but perhaps more importantly, they just don't provide a lot of evidence to support their reassurance in a general sense. And when they do, it is other jurisdictions or unspecified sources of evidence for this reassurance. And we see something a little similar in Ontario, where again, they focus primarily on their internal experts as their source of evidence, with a few references to unspecified local experts as well in column H, but again, overall, very few references to both evidence and reassurance in the same capacity, especially when you compare these numerical values here to these. I think they account for something like less than a third of total crossover between the two categories altogether. So all in all, there's very little overlap between either government talking about reassurance in any real capacity and them supplying evidence to support that reassurance. So the last theme I'll be talking about tonight is the idea of personal responsibility and doing the right thing, which is a pretty nebulous term that came up a couple times throughout our research. And this isn't necessarily the primary focus of the project. We're focused more so on schools. But it does raise really interesting questions about collective and individual responsibility throughout the pandemic. So this is another chronological representation of personal responsibility and references to its various forms throughout Waves 1 and 3 in both provinces. We can see in Alberta in Wave 1 that keeping vulnerable people safe in row 6 was the highest referenced idea of personal responsibility throughout this wave, followed fairly closely by keeping others safe. So this to me speaks to a more collective, community-minded perspective on personal responsibility. You should take action to keep others safe or to keep vulnerable people in your community safe. Though there are a few other references to other aspects of responsibility as well, such as not breaking rules or risking fines, or again, doing what's right. In Ontario, getting ahead of myself. In Alberta by Wave 3, however, we see that this does a little bit of a flip with a focus on these top two categories here, allowing for fewer restrictions or not breaking rules or risking fines, become the most heavily referenced types of personal responsibility by Wave 3, even though they had relatively small numerical values in Wave 1. And while the idea of keeping others safe still features quite dominantly by Wave 3, we can see that keeping vulnerable people safe dropped from being the highest reference point of personal responsibility in Wave 1 to being the least reference point by Wave 3. And unfortunately, we see something similar in Ontario, though again to a lesser degree with less solid numerical strength. So in Ontario, we see that there was a focus on vulnerable people and keeping them safe in wave 1, 7 references, as well as talking about rules and fines, and again, doing the right thing, which again, like whenever that's coded anecdotally, by the way, it is exactly what they say in the document, is just do what's right. It's literally that vague. So we move on now to Ontario Wave 3. We can see that this focus on not breaking rules, not risking fines, as well as on doing what's right, increases to be quite a bit stronger by Wave 3, with again, less focus on keeping vulnerable people safe. And not to the same extent as in Alberta, where it went from being the most referenced category to being the least, but still to a bit of an alarming extent, especially considering some of the other things we've seen so far, such as reassurance, evidence, and their mobilization. So we can also look at how personal responsibility overlaps with instructions for individual action, with instructions being on the y-axis and personal responsibility being on the x. This graph here represents Alberta in both wave 1 and 3 combined. And we see that there isn't a ton of overlap, again, between personal responsibility and instructions for individual action. So if you're being told, or if you are publicly messaging out that you need to keep the community safe, you need to keep vulnerable people safe, then how are we meant to do that? You would expect there to be some overlap between the issuance of that request and some instructions on how to achieve it. And we find that at least in the Alberta case, that the dominant messaging appears to be, again, around vaccines. So we can see in column A, allowing for fewer restrictions seems to overlap quite substantially with references to being vaccinated. Same with column D, keeping others safe, and not breaking rules or risking fines are all associated with vaccinations in these crosstabs. And something else that emerges from this graph is in column F, keeping vulnerable people safe. In all of the other columns we see here, there's very few other references to other types of instructions besides vaccinations. Column A, we can see that 13 references to vaccinations and nothing else is mentioned. But keeping vulnerable people safe has a bit of a spattering of a bunch of different instructions for individual action, all ranging in around the 3 to 5 mark numerically. But no one instruction is dominant overall. Again, to a lesser extent, in Ontario, we see a similar thing emerge. I believe vaccinations is mentioned in all of these except for column A, and actually in the keeping vulnerable people safe column, it seems. Though again, a bit more of a spattering in the final column, with one, in this case, emerging dominant, which is staying home in a general sense. So these are some preliminary findings from some early descriptive research that we're doing before we're delving into the causality questions involved with this research project. And there are a few key takeaways that emerge early on that I'm really excited to start exploring further. And the first is in regards to the use of evidence itself and the sources of evidence. So Alberta relies primarily on other jurisdictions and unspecified sources of evidence in its press releases and government briefings during this time, while Ontario primarily references their internal board of experts. Again, for reference, this is the chart I showed at the beginning. We see very heavy dominance again on other jurisdictions in Alberta, as well as unspecified sources. This to me raises some really difficult questions around transparency and accountability, specifically when communicating in times of crisis with the public. The second key takeaway is involved with the instructions for action. So the instructions for action were generally fairly varied in Wave 1, with a fairly diffuse representation of a bunch of different types of actions. Things like wearing a mask, or not getting vaccinated rather, or social distancing, something to that effect. But both provinces shifted their priorities almost entirely to vaccinations by Wave 3 at the expense of other tactics. So again, we see here, staying home if sick was the predominant messaging in Alberta in Wave 1, though the others were very well represented within these documents as well. And we see that by Wave 3, these references do still exist to other instructions for individual action, though it is very clear that their strategy had shifted almost entirely to a vaccine-dominant message. In Ontario, we see that they had focused primarily on reducing exposures, self-assessing for symptoms, and social distancing as their primary instructions for action in Wave 1, with a few references to others as well throughout. But these, again, fall off a metaphorical cliff by wave 3, with increased references to vaccinations by wave 3. The third takeaway is that both provinces altered their reassurance strategies quite substantially between waves 1 and 3, and perhaps more importantly, little evidence is actually used to justify this reassurance. So again, here we see that despite children and the messaging on children being fairly dominant in the Alberta narrative in wave 1, along with the other types of reassurance as well, these just kind of disappear from the narrative once wave 3 hits, and instead the focus shifts almost entirely to schools being safe and schools not being sites of transmission. In Ontario, they don't talk about children and reassurance in any capacity in either wave, though they do talk about, by wave 3, both the decision-based reassurance as well as the school-based reassurance. And again, evidence-informed reassurance is quite sparse within any of these documents. There doesn't seem to be a lot of overlap between references to evidence in any capacity and notions of reassurance. But when there is some overlap, expectedly, it is in the same areas that each province seems to prioritize for evidence mobilization, being other jurisdictions in Alberta and unspecified sources, and local experts in Ontario. The final takeaway is how Alberta seems to have shifted from a bit of a collective discourse around personal responsibility and keeping the community safe to a more individualized one that focused more so on adhering to rules and not risking fines for yourself. And I think perhaps, this is probably, in my opinion, one of the saddest charts on in all of the research we've done. We can see it most prominently in Alberta, a shift from keeping vulnerable people safe being the predominant reference to personal responsibility in wave 1, as well as keeping others safe, just in a more broader sense, to being the least referenced point of personal responsibility by wave 3, with a substantial shift focusing more so on fewer restrictions, don't break rules or risk fines. And in Ontario, to a lesser extent, we also see this reference to keeping vulnerable people safe in wave 1 drop down by wave 3 with a heavier focus on not breaking rules or risking fines and on doing what's right in a very vague sense. So these raise some So altogether, these raise some really interesting questions for me around a few different topics that I'm really excited to explore further as we get deeper into this project. The first of which being the idea of transparency. And this, to me, comes through most clear in the use of evidence shown at the beginning. If all of your evidence, or the majority of your evidence is coming from unspecified sources in your references to it in public communications, in a time of decreasing trust in many government institutions worldwide, what kind of message is that sending exactly? And I'm really interested to see, get more into the discourse about it and dive a little deeper and maybe get, more into that. The second being legitimacy. In a time of, again, immense distrust in government, it's really shocking to see so little reference to evidence being mobilized in a variety of different domains. There are also some slides that didn't quite make it into the presentation tonight just for space, though other variables as well, when cross-referenced with evidence, also showed very sparse results, unfortunately. And we'll be grappling with these questions, as well as the causality of the school closures within the province in our research paper that we're currently starting to get in the works. Hopefully we'll be presenting at the Canadian Political Science Association conference in May, which is the biggest conference in our field, which I'm very excited about. And that's an introduction to lessons in crisis, and I would be happy to take any questions you have.
Thank you very much for your presentation. I understand speeches and briefings that are written often have very different content. So did you consider speeches as a data source as well when looking for these numbers?
So these do not include any speeches to my knowledge. They're focused solely on briefings to the public. I'm sure many of us remember, I think it was, every morning or every other morning, government officials would come on and talk about daily COVID numbers early in 2020. So we're looking at those briefings, as well as press releases. These were the documents that were iterated directly to the press. They were pre-written. Some of the briefings also did include Q&A sessions, which were live and were transcribed. So there's a combination of both pre-written and live material within our analysis, though that is something definitely I think I will bring to the research team at a later time and possibly incorporate into a future project.
Thank you. Yeah, because like the political factor feels very important. Like if the premier is saying it, like, what do they want the public to think about themselves?
Yeah.
For voting. Yeah, cool.
Yeah, and that's something that we're actually I'm working on it actually right now. Like not literally right now, but like that's my next step in the project is looking at which specific actors are talking about these different types of evidence, different types of reassurance. Is the next step. So taking it down, from the government level or from the provincial level to the different waves to the individual. So that's actually like the next step.
Great.
Hi. I agree with you that one of the saddest things to see is how drastically they stop discussing keeping vulnerable people safe as a reason to care about COVID. So I'm wondering if you can speak a little bit more about that part of your research and the things that you're interested in going forward with that particular finding.
Mm-hmm. For sure. And I think something that a mentor of mine said when I was in like the later years of my undergrad degree was, I was really frustrated that I wasn't finding anything in a certain research project that I was assigned to. And I'm like, man, like nothing's coming up. There's no results here. And, I was 20 at the time and kind of dumb. And he said, like sometimes the lack of reference to something or the lack of evidence is also, really interesting in and of itself, right? So I do find the lack of references to protecting vulnerable people, particularly in the later stages of the pandemic, to be, interesting in a academic way, though very sad. And that is something that I brought up to the research team. I ran all of these myself earlier on and then made them nice and pretty for the presentation. But that is something that I brought up, was that point in particular. I thought it was, damning in a sense, and something that I don't necessarily have an answer for how I plan to explore that right now, since ultimately that kind of is the result of conversations with me and the other RAs and the PIs, though it is something that I'm definitely committed to looking at in more depth going forward. Thank you.
Yes, thanks for the presentation. I missed the first slides. Do you think that people really choose their words in a very particular way? So are there people in place for exactly this position in government communication, especially for schools and so? Or is this rather a dynamic of the culture or of the society in large? So people just don't care about the words, or just write themselves down something what they think is right, or and then these tables would not be so much interpretable, right, in this case.
Yeah, thank you. So one thing that I think I would also like to delve in a little more is looking again at the distinction between the briefings as well as the press releases. I do think that a static document like a press release, which had gone through some series of reviews beforehand, is probably going to have a bit of a different tone to it and different things discussed maybe, or different language used than something that's live in front of a press gallery. So I think that that's something that I will mention as well to the research team and try to incorporate as the project goes on, because I do think that there is a culture of choosing words very carefully. I wouldn't necessarily, I wouldn't say really at all that like words don't matter in like the political culture. And I think that's exemplified quite well when you're looking at the sources of reassurance, right? So the shift from focusing on children, being safe, reassurance based around children, schools, and decisions, and then focusing entirely on schools are safe. Well, you know, you can't really talk about schools being safe without also talking about kids and their conditions within those schools. So I'm obviously, you know, I cannot establish causality between that, but I do think it's very interesting that, you know, that discourse did evolve to exclude focusing on reassurance regarding children, to focus almost entirely on reassurance regarding schools. So I do think that, you know, words are chosen very intentionally, for better or worse, and that's definitely something that, you know, is really important, especially in qualitative, you know, contextual analysis.
Thank you. I was just wondering, so I've taught in Manitoba as a kindergarten teacher for the past 3 years during COVID, pandemic, and everything. And from even, like, from the approach you're coming from, I'm wondering if you're going to extend it specifically, even looking at more, I guess you guys refer to them as school districts here, or school divisions, because even as a teacher in Winnipeg, once those policies were implemented and once we were integrating back into schools and figuring out how we can return to in-person learning, which came back and forth in different waves as well and had different interruptions. Even within different school districts in the city of Winnipeg, there were very different policies in terms of, for example, like communal supply use in classrooms and how desk separations, and there were so many different policy mandates within different school districts within one city. So I'm wondering, just out kind of from that perspective, if you're going to extend this research into looking at schools as a next approach or a next step.
Definitely, thank you. And that's something that I've kept in mind throughout this project. I joined last May. The project had already been in operation for about a year prior to that. So I'm coming in a little bit, you know, behind the other folks. But one thing that I noticed early on was, you know, the levels to this, right? And one thing that I didn't talk about tonight, but one thing that we noticed when we were looking at Alberta was that there were a lot of references to specific school districts, for example. So there was a few times where I think it was Red Deer was instructed to go online only for like a week or so when other school districts within the province didn't have that same mandate. So it seemed to be a bit more of a piecemeal approach, almost looking at specific zones that need targeted intervention. And that's at the school district level, but definitely, you know, I hear my brother was in high school during the pandemic, so I definitely got a lot of that as well. I'm from Saskatchewan, so, you know, kind of prairie folk. And yeah, I think that that's something that would definitely be worth incorporating in the future. I think that that may have to be a different paper than the one we're currently talking about, just because it's a little bit more granular in scope, and this one is looking primarily at how governments communicate things like risk and evidence. Though I do think that looking at that more granular approach at specific schools and school districts more broadly would be really fascinating. And something that, you know, I just got my contract extension today, so hopefully I'll have this job for a little while longer. And that's something that I will bring up in the future. If it's not already on the docket, then maybe I'm unaware of it, but thank you.
Hi, Katelynn.
Hi, Sam.
Great, thank you for the talk. So as a rhetorician, loosely speaking, I'm very interested in the choices, the persuasive choices that are made here on behalf of the government, given the kinds of audiences that they're targeting, right? They're talking about their provincial citizens. To what extent have you at all looked at or tried to measure, I suppose, the efficacy of these choices, you know, in terms of, okay, did they work, right? Were people compliant with the kinds of policies that were put in place, and to what extent can we attribute compliance to the persuasive choices that are made here during these briefings?
So thank you, Sam. My initial reaction is that I think that if I'm interpreting what you mean by compliance correctly, which correct me if I'm not, I think it would be really difficult to measure in this instance for a couple different reasons. The first being that, you know, again, how do you comply with evidence that isn't being presented, I suppose? You know, something like schools are safe, it's like, okay, like we could maybe measure not like adoption of that mentality, but maybe how much people buy into it, maybe some more survey data on that kind of thing. I think there was survey data collected on an unrelated project, something to that effect a few years ago. I think the issue would be lining it up properly, like temporally. You know, we can't go back in time to 2020 and run surveys, unfortunately. That would be really cool, though. So I'm not totally sure how we might go about that, though I do think it would be interesting to kind of like ponder further. And maybe this is something that we can talk about over supper at some point, because I am curious about that. But I'm sorry that's not a more satisfying answer. But I would love to hear your thoughts as well from your perspective.
There really isn't a satisfying answer. Unfortunately, the big problem. It's kind of the big problem in communications is how do you measure how well your message is received. But yeah, so you know when we're talking about the persuasiveness, right? Like obviously strategies changed between 1 and 3 to a different extent because the audience during wave 3 is not the same audience as it was during wave 1. They may be the same physical person, but they are different, right? They've gone through, you know, a year and a half of the pandemic, and so the choices that you make when trying to persuade somebody presume previous attempts at persuasion as well, for good or ill. I'll let that go because I don't really have a question here, but thank you.
No, thanks, Sam. I appreciate it.
Well, then the question's been.
Hi. Picking up on that, I think one of the pieces that is the easiest to measure in terms of people taking action is vaccination rate. And I was wondering, I noticed when the slide first came up in the difference between, because obviously recommendation during phase 1 wasn't vaccination because the vaccine was not available, but the much greater significance proportionally it seemed like that Alberta was putting on vaccination in wave 3, whether that could be attributed to a lack of people already having been vaccinated. Whereas, so it may be kind of the opposite effect here, that if people have already done the thing, then there ceases to be as much need for continuing advisement. So then the things that are being recommended are exactly the things that people haven't been doing, which is why they're being recommended.
For sure. So definitely not in a position to like establish any sort of causality at this time. You know, purely descriptive at this point. But I do think that is something that I want to grapple with, like specifically like once, you know, I'm on Christmas break now from the project, but once things kick up again in January, I think that's something that I'd like to look at in a bit more depth. And specifically, you know, like bring up some data on, again, vaccination rates at XYZ point in time in both provinces, looking at things like, you know, were there any surveys run on maybe mask usage by like Angus Reid or anything like that during that time, and using those, you know, as imperfect examples to kind of look at those types of relationships between messaging and adherence, but also useful, I think. So yeah, that's something that I'm definitely looking forward to talking about and like exploring a little bit more. I think that's just kind of like a next stage of the project type of thing. But thank you for bringing it up.
Thanks, Katelynn. Some of this suddenly seems a long time ago, but those of us who were here in BC, you know, two and a half years ago, will remember the sudden cult status achieved by the Provincial Health Officer, Bonnie Henry. Some of us may just about remember the name of the health minister who used to appear with her on those daily briefings. I had to really rack my brains to remember that his name is Adrian Dix, but no one has forgotten Bonnie Henry, or that very early on, at a time when nobody really knew what we could usefully say that would help at all, she came up with that mantra of be kind, be calm, be safe, which for a while at least I think created a perception among people living in BC that, you know, things were being quite well managed from a rhetorical and public discourse point of view, even though we discovered soon afterwards that she was getting hate mail on a terrifying scale. I expect people are doing comparable studies for BC and other provinces, you know, like the ones that you're doing for Ontario and Alberta. But how if you were dealing with those briefings for BC, would you code be kind, be calm, be safe. What kind of a thing on your chart is that? Or what kinds of thing is it all at once?
So thank you for that. The first thing that comes to mind is that I could make an argument for it to either go under instructions for individual action based on a couple things we already have coded under that umbrella, or under personal responsibility. So if I'm going to, let's see, or actually perhaps maybe, I redact that actually. I would say personal responsibility is where it would go under. And I'll bring up the slide here. So I mentioned before, like this nebulous idea of doing what's right. That was not initially in the code book when I came onto the project. After I got about halfway through the Alberta briefings, I noticed that it was something that was coming up more often than not, especially alongside other types of personal responsibility or instructions for individual action. So for example, someone might say, it's important that we do what's right. Get vaccinated, wear a mask, stay home is, a typical example of how that might proceed. So I would say that even though a lot of the times this notion of doing what's right in a very vague sense went along with instructions for individual action, we decided to settle on personal responsibility because it has a bit more of an emotional appeal to it than an instruction. And I have a feeling that Bonnie Henry's slogan would also fit into that category. It's technically an instruction of be kind, wear a mask. But it has that more emotional sense to it, that sentiment, that I think, using the same justification that we use to include doing what's right under personal responsibility, if we were to include it and include BC as a case, I have a feeling it would probably be placed under there. Or perhaps under its own, umbrella of just emotional appeals in a more broad sense. And sentiment itself, the positive or negative aspect to what is being said, is something that we also accounted for within the coding. Though it didn't feature at all in my presentation tonight, because that is, again, another next step that we're taking in the new year. So I would say that it would fit under personal responsibility due to that emotional connection and that, almost intangible difference between that and an instruction, if that makes sense.
It was before they were even being consistent about masks. It was at that point when actually the orthodoxy seemed to be, masking isn't what we're asking you to do. Whether that was because they were protecting the supply of masks or for other reasons, I don't know that any of us is quite clear about that yet. I was just interested, by the way, if my recollection is right, this was a response before anyone really knew, in more practical terms, what doing the right thing would even look like. It was an attempt just to manage the mood. And I think anyone who had any role administratively in responding to COVID at any point in the pandemic so far figured out pretty early on that mood management suddenly was a priority. And someone like Bonnie Henry, or perhaps some of the other politicians in other provinces in other ways, who managed to get a handle on that, at least for a while, got what looked like positive results in terms of at least public opinion. But I think you're right. I think it's a complex utterance, and it may be succeeding in doing a few things at once.
Yeah, and I almost upon further reflection, I almost think that you could also make an argument to put it under reassurance, but in a separate category that's not explicitly related to schools. So the reassurance coding, it was all in some capacity related to schools. But something like that, it still has that reassurance to it, right? That emotional connection to the people in a time of great uncertainty. So I feel like that and, maybe even doing what's right in a bit of a different sense could also fit under that reassurance. Yeah, that emotional sentiment is so important throughout all of this messaging, right? In so many different capacities. Thank you.
We have time for a last question.
Hi, Katelynn. Thanks for your talk. My question is kind of about what happens next. So you've identified that there was a little bit of difference in the communication in both provinces. Since this happened, Ontario re-elected their premier, and Alberta ousted theirs. Do you think this had anything to do with that, I guess is the question.
I mean, yes. I don't have, or I can't recall any specific polls that were done on the topic. But I mean, even looking at the opinion polling leading up to the leadership race in the Alberta UCP, it was pretty damning for the Kenney government on a variety of fronts. I think that would be something that isn't necessarily within the scope. See, I don't even want to say that it isn't within the scope, because I definitely see how it is. I'm not sure if that's the direction of this particular project, but I do think that is something that should be explored further, is that relationship between electoral outcomes and COVID. Specifically thinking back to early 2021, when there was a variety of provinces that did have elections, Saskatchewan, Newfoundland, Nova Scotia, I believe, maybe a few others. And I believe they all re-elected their incumbent governments, if memory serves. So I do think that looking at electoral politics in times of COVID, specifically at the beginning of the pandemic, as well as now that governments have shifted and changed almost 3 years in, I do think that's something that hopefully emerges as a topic of study in a more broad way. Yeah, I'm sorry I don't have a more conclusive answer than that, but it is super interesting and something that I hope, if I don't do the research, hopefully someone else does, because I think it's really important.
Thank you.
Okay, well, with this we've come to the end, unless there is a last minute question. If not, please join me thanking Katelynn. And hopefully see you all next Monday for the last of our resident member series before the break.